Hi guys, it's Dr. Erik here. I'm going to go through a few thoracic exercises that you can be doing on the home front. These are critical for your posture and recovery of healthiness in your movement and your function, and also often, in many cases, of forward head posture involve a rounded thoracic spine. So we want you to be able to overcome and correct that. I want to begin by talking about the wall angel. This is called the wall angel because you want to think about a snow angel. We're going to line up the heels, the bottom, and then our elbows and wrists against the wall. We're going to come straight down, and I want you to contract that rhomboid area like you're doing a lat pull down. Okay? You want to hold the contraction right here, and the wall is just your guide. So it just helps you to make sure that we're not pulling forward. If you are, pull your feet away from the wall, and then you can go in a more guided posture. You can see my right hand's coming forward. That implies that I've got maybe some shoulder discomfort. So if you have some of that, understand that you're just going to work on improving your position and your tone so that you can perform the exercise with greater integrity. The second exercise is externally rotating the thumbs, and we're going to keep the elbows, act like they're glued to the side, and we're going to work outward from here. So you're going to hold an erect posture, and as you do that, you can even squeeze your glutes. It all helps to increase that extension in the thoracic spine. We're going to externally rotate and only go to the point where you maintain those elbows against your side. You don't want to open it up like that. This is just a simple exercise to again, work on those openers, the thoracic openers. We can also do things like the rolling the shoulders back and forth. These are great to invoke movement in the upper thoracic spine and engage the shoulder joints. So I love all of those exercises from the standing posture. Again, the wall angel, the external rotation movement. You can also grab a band and you can cross stretch, or you can do put the band under the feet and hold it up like a V. Those are really great supports and dynamic stretches for your thoracic spine. In a seated position, we can do some very focused, isolated stretches, and I like this one because it helps work with the scapula, or what we call the shoulder blade in layman's terms. So you want to cross your arm that of the side that you're not stretching. So you're gonna hold it either under your leg, or you can use the chair support. We're gonna put the other arm behind the head, and you're going to cross to the opposite side, and then we're gonna come up and out, really focusing on the stretch that we're giving to that shoulder blade. You should feel between the shoulder blade and the spine, you should feel a stretch there and an exercise of the rhomboids. So we're gonna cross in here, open up, and we're going to hold that. We're going to cross, and then we're going to open up and hold that. There's a couple different ways to do that exercise, and I'll show you one on your stomach as well. Another variant of this is that you can put put your arms in a cross position and cross down and act like you're hitting a home run. That's a great way to open up the thoracic spine in a slightly more concealed position. This also, some people are computing and doing desk work, and this is a great place to integrate the wall angel and the external rotation, or do the shoulder rolls. But from this position, we're also going to think about the interface between the neck and the thoracic spine. So push the chin in right here, and you should feel the head kind of rocking wide. This stretches the lower neck to the upper neck, and you want to think about the joints of the lower neck, the joints of the upper neck. It's like a ball that glides in that joint. So when we rock, you'll feel it kind of drop and then extend, and it's a great stretch to the lower neck as well. The spinal twists, you're going to turn your head to the left or to the right first, and then you're going to twist your thoracic spine. This isolates the interspinous ligaments of your thoracic spine and gives another great stretch. You don't want to just go like this. You want to first turn your head and neck, okay? So we're going to the opposite side now. I can tell that that's the weaker side. When you're doing these stretches, observe which side you tend to excel at and which one you may not. Lastly, I'm going to move into the floor exercise. One exercise that I absolutely love is laying on your side and opening up the thoracic spine from here. So keeping your lower extremity fixed, and we're going to open up right here and just let the body slowly open up that thoracic spine. You might spend 5 to 10 seconds in that thoracic open position. And we want to exercise, and you can support your head here too if you need to, but we're gonna do a few reps of that just to increase the movement in that area. Also from the floor, we can do another variant of the one that I showed you on the chair. So this one, we're gonna open like this, we're gonna internally rotate, and then we're gonna come up and out. So that tells me where I'm at in terms of exercising that rhomboid spine again, that rhomboid muscle along my thoracic spine. And I've got to do some work on that. So some of these exercises, they also show you kind of where you're at strength-wise and flexibility-wise. If you're more dynamic on the floor, you could do the world's greatest stretch, which stretches multiple areas, but it also stretches the thoracic spine. You're gonna put this in Lancer stance. You're gonna tuck the arm in and then move up and out in this position. So that's a great hip opener, thoracic spine opener. These are just the beginner's point, and you can stem off of these and do a lot of different things. But we do want our patients to understand that home care is vital. So thanks for tuning in, and make sure you tune in to our stretches for your low back as well.